Hi, my name is Alicia Harvey, and I am the neuroscience medical health professional at Baylor Dallas. What I specialize in is hemiparesis. I help individuals that have had a stroke, and now they have decreased muscle function in one side of their body. It just depends on what side the stroke was on. If it was the left side or the right side. We'll also help them, go through physical therapy, rehabilitation, speech therapy, just depending on what side of the brain was damaged the most. Also, it depends on how severe the stroke was, because if it wasn't that bad and they have most functions still, then their physical therapy won't take that long. But if it's been really, really bad and they really have low functioning levels in that side of the body, then we will keep them a little bit longer. We'll help them go through physical therapy, speech therapy a little bit longer. So there has been typically there's about 80% of individuals that survive from a stroke have hemiparesis. So in our hospital, we've experienced about 77%, which is about a good 80% of that. So from the amount of people that come out, it's like 77 people to 100. The total cases that we've had this past year was 1,268 patients that's come in that survived from stroke. But all those patients weren't people that were that had hemiparesis. Some of them were just fine. They were able to, they had a little bit muscle function loss, but it wasn't so severe that we had to go through all the physical therapy stuff in depth. So we have about like 77% of that whole population that has come in, and has gone through speech therapy, has gone through physical therapy, has been held in stroke rehabilitation, just to help them get back into their normal life. Sometimes most of them won't even get back to the full function, and they will have to have some type of assistant with their activity of daily living throughout the course of their life. So this one particular case I have experienced this guy twice. This is the second run-in with him now. This is the second stroke that he's had. His first stroke was 3 years prior while I was working here at this facility. Now he has come back again with another stroke. So just a little compare and contrast with that. Basically his stroke level, from the stroke level, was on the same side. So the stroke happened on the right side of his brain, so now he has left side paralysis. Not paralysis, hemiparesis, sorry. So with that, so from his first stroke, he basically has like really decreased level of motor function, and now from this one has basically the exact same. Like, even though he's gone through all the physical therapy and speech therapy, it basically has went back to where he was at the beginning when he first came in with his stroke. So what we're gonna do, we're gonna put him on some more medication. We're gonna give him something that's gonna help him, like some blood thinners, some ACE inhibitors, just to help him not have clots as frequently anymore. We're going to monitor him. We're going to have him come see a dietitian and a nutritionist, because we're going to want to make sure that the food that's eating isn't bringing his cholesterol levels up, that's allowing plaque to build up, which is allowing the stroke to happen more frequently now. Since it's the second one, we're going to be super cautious about all this. We don't want him to have a third one, so we want to make this 2 and done. So with that, we're going to have him come in once a week. We're going to get his blood test and everything done. We're going to make sure everything's looking great. No plaque buildup or anything like that. We might have to do surgery after that. With this, we're also going to give him some speech therapy, some physical therapy like normal. This time, we're going to have our speech therapy every single day for at least 30 minutes. If he wants to have longer, we can do that. It's totally up to him. We're going to have our physical therapy at least 3 times a week. With this, we're also going to stimulate the neuromuscular junction for him to help him get that nerve innervation going back, so he can have more motor control a little bit quicker. We are also just going to have him just do assessments every so often, just to see where his progress is, to help prevent individuals from a stroke. Is that we want to, it can happen to anyone. We have seen a number of cases from individuals that are as young as 18 to individuals as old as 87 that's come through. But the younger you are, the more likely it is for you, just to have that normal function back. The older you get, it's a little bit harder, because your muscles are already decreasing and everything's already degenerating at that age. So it's a little bit harder with older individuals. But our individual, he's a white male. He is 47 years old. He's in the middle class rank. And so yeah, we're just gonna help him out the best we can. So to help prevent individuals with this, we know we have the FAST acronyms. Basically, it's just something that helps other people innocent bystanders to see what's going on with someone that might be having a stroke. So F is for face, if you see any droopiness in the face, either side, left or right. A is for arms, if you see any weakness. And that basically, if it's it can also be arms, legs, any side of the body, anything that's on the same side of the body. S is going to be for speech, so any slurred speech, any words that like aren't making any sense, like in the sentences or anything like that. And T is going to be time. Everything is going to happen so quickly that the faster you are able to notice it and the faster you're able to call 911, it's going to be the better, because the stroke hasn't had that much damage on that individual yet. So the quicker you're able to find out, the quicker you're able to like establish those first three points, then just call 911 and we'll be able to help, and this person won't be disabled as much. So this, we just want to implement this in everything, all the schools, because it can happen to anyone now, since it's, stroke is rising. It happens to anyone. It can happen in high school, it can happen in middle school. So we want everyone to be able to be aware of this. It can happen to your mom, your dad, your aunt, uncle, grandparents, anyone in your family. So we want everyone to be able to be aware of this. So we're going to have educational things. It's going to happen throughout the schools. It's going to be incorporated with their health class. So what we do as professionals, since an individual comes like this and they have such a degree of things that they need to be done, we're gonna hand them over to like therapists, speech therapists, physical therapists, anything else that's gonna help them, recover a little bit better. And that is it.